Lymphoid progenitors are produced in which of the following tissues? A. The bone marrow. B. The liver. C. Gut-associated lymphoid tissue, GALT. D. All of these. The answer is D. All of these. Lymphoid progenitor cells are produced in all of the following tissues: the liver, the bone marrow, spleen, and gut-associated lymphoid tissue, mainly found in the liver and intestines. However, note that the vast majority of all blood cells are produced in the red bone marrow of long bones by hematopoietic stem cells. Which immune cell is specialized for immunity against multicellular parasites? A. Eosinophils. B. Basophils. C. Monocytes. D. Natural killer cells. The answer is A. Eosinophils. While all of the cells listed may have some indirect involvement in the overall response to a parasitic infection, eosinophils are the only immune cells that are specialized to respond to multicellular parasites, especially helminths such as hookworms and pinworms. Mast cells contain high concentrations of which of the following? A. Tryptase. B. Heparin. C. Histamine. D. All of these. The answer is D. All of these. Mast cells are rich in granules that contain high concentrations of heparin, histamine, and trypsin, among other preformed proteases. These granules also contain serotonin and various eicosanoids. The function of mast cells is primarily to regulate immune, inflammatory, responses to allergens. Which of the following would be considered to be part of nonspecific immunity? A. Plasma cells. B. Macrophages. C. Memory cells. D. CD8 T cells. The answer is B. Macrophages. Macrophages, the main blood cells responsible for phagocytosis of debris, bacteria, and virally infected cells, are part of the nonspecific immune response. While they are able to recognize self versus non-self proteins, they are not uniquely sensitive to any particular non-self protein type. Rather, they phagocytose foreign matter as well as cellular debris. Plasma cells, memory cells, and CD8 T cells are all lymphocytes, and as such they are all part of the adaptive or specific immune system, meaning that they are uniquely sensitive to particular pathogenic proteins. Which of the following antibacterial enzymes is present in saliva? A. Linguolipase. B. Lysozyme. C. Kallikrein. D. Amylase. The answer is B. Lysozyme. While all of the enzymes listed are present in saliva, lysozyme is the only enzyme listed that has antibacterial properties. This enzyme, present not only in saliva but also in tears, sweat, and breast milk, damages bacterial cell walls, making it an important part of the innate immune system. Amylase breaks down carbohydrates, lipase breaks down lipids, and kallikrein breaks down proteins. Which of the following cell counts is particularly diminished in patients with AIDS, and is used to measure disease extent? A. CD8 T cells. B. Platelets. C. CD4 T cells. D. Monocytes. E. Neutrophils. The answer is C. CD4 T cells. In AIDS, which is the most progressed stage of HIV, the cell type that is most significantly diminished is CD4 T cells. Oftentimes, the degree of disease progress of HIV and AIDS is established by monitoring the patient's CD4 T cell count across the course of the illness. The CD4 count guides differential diagnosis when patients with HIV or AIDS present with various complaints, and also guides what prophylactic measures, for example antibiotics, antifungals, are administered to these patients. While CD8 T cell, monocyte, platelet, and neutrophil counts may each be decreased for various reasons in patients with HIV and AIDS, the most substantial association between diminished cell count and HIV/AIDS is that of CD4 T cells. How many lobes total are there in the human lungs? A. 3. B. 5. C. 4. D. 6. The answer is B. 5. There are 5 lobes total in the human lungs. The right lung has 3 lobes, the upper lobe, the middle lobe, and the lower lobe, while the left lung has 2 lobes, the upper lobe and the lower lobe. What is the name for the topmost part of the lung? A. The apex. B. The hilum. C. The lingula. D. The trachea. The answer is A. The apex. The topmost part of the lungs is the apex. This area extends into the neck above the first rib and is the location auscultated for a diagnosis of a Pancoast tumor. The lingula of the lung is a small flap of the lowest part of the upper lobe of the left lung. The hilum is the entry point of the lung for the bronchi, pulmonary artery and vein, and nerves. The trachea is not a part of the lung at all. It is the cartilaginous tube that connects the pharynx and larynx to the lung. Which of the following lists of airway structures is in order from largest to smallest? A. Trachea, bronchiole, bronchi, alveoli. B. Trachea, alveoli, bronchiole, bronchi. C. Trachea, bronchi, bronchiole, alveoli. D. Bronchi, trachea, bronchiole, alveoli. The answer is C. Trachea, bronchi, bronchiole, alveoli. The largest airway structure is the trachea. This branches into 2 smaller bronchi, which enter the left and right lung and bifurcate further into smaller bronchioles. The bronchioles give way into the smallest structures of the lung, the tiny grape-like clusters of alveoli.
What structure of the lung is primarily responsible for controlling volume of airflow during respiration? A. The alveoli. B. The bronchioles. C. The trachea. D. The bronchi. The answer is B. The bronchioles. The main mediator of airflow during respiration is the bronchiole. These tiny airways are wrapped in smooth muscle, which allows them to contract or relax in order to restrict or increase airflow in the lung. The trachea and bronchioles are cartilaginous rather than muscular, and are unable to constrict, while the wall of the alveolar sac is also devoid of smooth muscle, made up only of epithelial cells, capillaries, and connective tissue.
Which of the following allows debris to be removed from the lung? A. The mucociliary escalator. B. The pleural lymph system. C. Bronchiolar constriction and dilation. D. Granulation. The answer is A. The mucociliary escalator. The system by which debris is removed from the lung is termed the mucociliary escalator. This is made up of two parts, the mucus produced by respiratory goblet cells, and the wave-like movement of cilia covering the bronchioles and bronchi of the lung. Bacteria and particles of debris are caught in the mucus coating the cilia, which is then passed in waves upward toward the trachea. Once it clears the trachea and enters the pharynx, it can either be coughed out or swallowed. The major alveolar cell type, making up 95% of alveolar cells, is type I. Only 5% of alveolar cells are type II, yet they serve a vital function in respiratory physiology. What is the function of type II alveolar cells? A. They are the site of gas exchange. B. They secrete surfactant. C. They nourish the type I cells. D. They are important for the integrity of the alveolar connective tissue. The answer is B. They secrete surfactant. Type II alveolar cells secrete pulmonary surfactant, a lipoprotein complex that is essential for lung function. This surfactant acts to break up the surface tension of fluid coating the lung air spaces, allowing for alveolar compliance and reducing the buildup of fluid in the lung. Lack of surfactant can lead to atelectasis, or collapse of part of the lung. Which of the following is the primary muscle of respiration? A. The intercostals. B. The scalens. C. The sternocleidomastoid. D. The diaphragm. The answer is D. The diaphragm. The most important muscle of respiration is the diaphragm, followed by the intercostals. The sternocleidomastoid and scalens are considered accessory muscles of respiration. How do bronchioles respond to an increase in the partial pressure of carbon dioxide in the alveoli? A. They secrete mucus. B. They constrict. C. They dilate. D. The bronchioles do not respond to changes in the partial pressure of carbon dioxide. The answer is C. They dilate. Carbon dioxide has paracrine effects in the airway, causing the smooth muscle of bronchioles to relax. When the partial pressure of carbon dioxide in the alveoli increases, the bronchioles dilate. This allows for increased ventilation. What nerve innervates the diaphragm, necessary for normal inhalation? A. The intercostal nerve. B. The phrenic nerve. C. The subcostal artery. D. The vagus nerve. The answer is B. The phrenic nerve. The diaphragm is innervated by the phrenic nerve. This nerve exits the spine at C3, C5. In the case of spinal cord trauma, if injury occurs above C3, the diaphragm is no longer able to function on its own and breathing assistance is generally required. Which of the following terms describes the maximum volume of air a person can exhale after maximum inhalation? A. Functional residual capacity. B. Residual volume. C. Vital capacity. D. None of these. The answer is C. Vital capacity. Vital capacity is the maximum volume of air a person can exhale after maximum inhalation. Residual volume is the air that remains in the lung after forced exhalation, while functional residual capacity is the volume of air that remains in the lung after a relaxed exhalation. In the average adult, how much air remains in the dead space of the lung after normal expiration? A. 250 milliliters. B. 750 milliliters. C. 150 milliliters. D. 70 milliliters. The answer is C. 150 milliliters. Dead space is the volume of air that remains in the trachea, bronchi, and bronchioles during respiration. It does not enter the alveoli and so does not participate in gas exchange. In the average adult, the amount of air left in the dead space after expiration is 150 milliliters. What is the average volume of air breathed into and out of the respiratory system during tidal breathing? A. 1,200 milliliters. B. 1,000 milliliters. C. 500 milliliters. D. 750 milliliters. The answer is C. 500 milliliters. Tidal breathing is the term for relaxed inhalation and exhalation, as opposed to maximum inspiration and forced exhalation. The average volume of air breathed into and out of the respiratory system during tidal breathing is 500 milliliters. Which of the following would cause bronchoconstriction? A. Cold air. B. Allergens. C. Parasympathetic input. D. All of these cause bronchoconstriction. The answer is D. All of these cause bronchoconstriction. There are many factors that can cause bronchoconstriction. Some of them are normal physiological responses, such as parasympathetic input or decreased partial pressure of carbon dioxide in the alveoli. Other causes are pathological, such as allergic bronchoconstriction or asthma triggered by cold air. What are the two types of alveolar cells? A. Interstitial cells and active cells. B. A cells and B cells. C. Type 1 and Type 2. D. Primary and secondary cells. The answer is C. Type 1 and Type 2. There are two types of alveolar cells, Type 1 cells and Type 2 cells. Each cell type has a unique function within the alveolus, and the dysfunction of either cell type results in serious respiratory pathology. Type 1 cells are simple squamous epithelial cells that account for about 95% of all alveolar cells. They are the primary cells responsible for diffusion of gases across the respiratory membranes. Type 1 alveolar cells are responsible for secreting surfactant, which facilitates the diffusion of substances across the epithelium. When the diaphragm contracts, lung volume dash. A. Increases. B. Diffuses. C. Decreases. D. compresses. The answer is A. Increases. The diaphragm is a thin sheet of muscle that separates the thoracic cavity from the abdominal cavity. At rest, it is drawn upward into a dome-like shape under the lungs. When the diaphragm contracts, the dome flattens out, which increases the size of the thoracic cavity. The negative pressure allows the lungs to expand and fill with air, causing an increase in total lung volume, inhalation. What chamber of the upper respiratory tract is shared by both the respiratory and digestive systems? A. The pharynx. B. The soft palate. C. The esophagus. D. The sinuses. The answer is A. The pharynx. The only chamber of the upper respiratory tract that is shared by both the respiratory and the digestive systems is the pharynx. The pharynx is the part of the throat that is immediately posterior to the mouth and the nasal cavity, and superior to the trachea, larynx, and esophagus. Which of the following is not a division of the pharynx? A. The sonopharynx. B. The oropharynx. C. The nasopharynx. D. The laryngopharynx. The answer is A. The sonopharynx. The pharynx is made up of three divisions: the laryngopharynx, the oropharynx, and the nasopharynx. There is no portion of the pharynx called the sonopharynx. Which of the following pairs of sinus is absent at birth, and is not fully developed until puberty? A. The ethmoid sinus. B. The frontal sinus. C. The sphenoid sinus. D. The maxillary sinus. The answer is B. The frontal sinus. The frontal sinuses are not present at birth. They begin to develop in the first few years of life, but they are not fully mature until after adolescence. The sphenoid, maxillary, and ethmoid sinuses are present at birth, though they are underdeveloped and similarly do not mature fully till late childhood or adolescence. Which of the following is a flap of cartilage that covers the opening of the windpipe during swallowing to prevent aspiration? A. The cricoid cartilage. B. The hyoid. C. The tracheal cartilage. D. The epiglottis. The answer is D. The epiglottis. The small flap of cartilage that covers the windpipe to prevent aspiration during swallowing is the epiglottis. It is located at the base of the tongue and attached to the entrance of the larynx.